Hello, I welcome you once again to our discussion on Indigenous, hence the Indigenous voices. It is so strange and unusual what is going on around the whole world this time. Our heart goes out to families, communities, and nations that are hard hit by the coronavirus pandemic. We say take heart if your family is hard hit, if your community is hard hit. As you can see, it has also brought us to an unusual setting that we are having this recording today outside. Not our usual classroom setting, and therefore welcome you today to our discussion on the topic sign language use or sign language attitude, deaf and hearing impaired. One may wonder why the topic, and one may wonder the difference between deaf and hearing impaired. So as that being said, in our studies so far, we have found out that there are some deaf people who have not identified with the cultural and linguistic identity of deaf people. So in our studies, we have seen more of families of deaf children that we have met in terms of our studies, who continue to narrate how their children became deaf. When we talk about deaf and hearing impaired, we mean deaf, talking about those deaf people that identify themselves as deaf culturally and linguistically. And hearing impaired, talking about those people that identify themselves as being hearing impaired or as being disabled because they lost hearing. So in that case, we're going to be talking about deafness and hearing loss. So hearing loss, whether congenital or organic or whatever, it is a situation when, or a condition rather, when a person loses his or her hearing and there is an impediment or there is an impairment of hearing, and which may affect some other aspects of that person's general activity. So in the course of our studies, we have seen more of people who we could classify as hearing impaired, whether as children, students in school, and adults. Because most of our deaf persons we have identified are those who regret their condition or those who would want their condition to change. This is different from some other deaf persons who find themselves in families that where maybe the father, the mother, or the grandfather and the mother are deaf and they are deaf. So we could call second generation or third generation deaf persons. In most cases, these people identify themselves culturally and linguistically as deaf. Even if a hearing person is born in that family, in some cases also they identify with this culture and they become part of the entire deaf family. These two situations, these two settings determine the attitude of a person towards sign language use, and this is what we are going to be discussing in the next 2-3 weeks. Treating this topic today, what do we want to streamline? We want to look at how deaf people regard sign language use and their attitude towards it, and how hearing impaired regard sign language use and their attitude towards it. And this will lead us to what goes on in an average Indigenous African deaf community where sign language is not frivolously used among deaf and hearing, and in some other ones where they are also used that way. The first thing I want to discuss today borders much on what causes hearing impairment, what causes hearing loss. And I know this is somewhat a controversial aspect of my study, but I'm going to try as much as I can to stay within the limits of my expertise as a sign linguist and speech and hearing scientist. I have been doing research for the past 6 years in deaf communities across Africa, And there has been a whole lot of data that we have collected in amongst deaf people and also sign language use. And one aspect of our research that we do not always discuss is this issue that I want to discuss today: what causes hearing loss in an average indigenous community. So the picture you are seeing here is a picture of parents who narrate how their children became deaf. Each of these parents, their children became deaf after birth, within the first 5 years of age. And each of them narrates what they think happened. It is out of this study that we got the data that informed us that over 75% of deaf children born in these communities that we have studied became deaf because they became sick. That means they became deaf as a result of sickness. The rest of the 25%, our study seems to suggest also that the reasons some of these ones became deaf after birth may have been an inherent reason from the mother to the children for those that were born deaf. How did we get to this conclusion? We got to this conclusion because each of these parents narrate how their children became deaf, most of them as a result of one sickness or the other that affected their hearing system. And this is about 75% of them by our estimate. The rest 25% is estimated that the issues that affected these ones that were born and they became deaf after birth may have been related to those that also became deaf before birth, because the parents narrated how the mothers especially, how they were sick during the pregnancy, and in each of those cases they had antibiotic injection. And that leads us to the point that I want to make in this discussion today: the issue of antibiotic injection or medication or drug for a pregnant woman or to children, babies, when they became sick. So one of the major causative factors of deafness that we found out in our studies is the antibiotic injection or drugs. And in some of the African countries, especially Nigeria, where I started my studies, a lot of antibiotic injection and drugs are used when people fall ill. Some of us went through the system where as soon as you become ill, you take antibiotic. And so almost all these mothers narrated how they were given antibiotic, or the infant, when they became ill, how they were given antibiotic. This was one factor that we found out. And another factor is when a child becomes ill, runs temperature, we also found out that some of the parents do not know how to manage the high temperature. Some of the mothers narrated to us how instead of dabbing the child, the baby that is running temperature, and maybe using cold water or what, the mother usually rubs local palm kernel oil and covers the child. That is the story we got from some of these parents. And in some of those occasions, the child ends up convulsing. And the child that convulses ends up losing hearing after 1 or 2 days of coma. So some of these parents told these stories. So high temperature and the mismanagement of it. Related to that is the meningitis issue. But in the area I started my study, we didn't see much of the meningitis issue, but it is more common in the northern part of Nigeria because of the high heat. A lot of children came down with the high temperature and they became ill and they became unconscious and lost their hearing in the process. These are three major causes of hearing loss we encountered in the course of our study. The next, which is the most controversial, is the issue of injection. Any other type of injection that is called vaccine. Some of the parents narrated that their children became ill after taking a vaccine injection. As unproven as that is, because that's not what we are dealing with in our studies, we recorded these stories from some of the parents. I could remember one of the parents, a father, as he narrated to us how his daughter was sick and was due for an injection that she needed to take. And he went to a doctor friend of his and told the doctor that the child needed to take a vaccine injection but was having fever, but the doctor went ahead and gave the injection anyway, and the child became unconscious and lost hearing when she woke up. We had these kind of stories from some other parents, and so we know that further scientific studies can reveal what may be the underlying cause, but I'm treating this as raw as data we got from the field. All right, so having explained what causes deafness as we've seen them in and around the communities that we have studied, what we are going to be looking at is these deaf persons who became deaf as children or were born deaf in this manner, whose parents continue to regret, lament that they had deaf children. What attitude was passed to them from their parents, their immediate families, and their communities? That is where we are having the focus of our discussion. What attitude was passed onto these children as they grew up? What linguistic attitude, what cultural attitude? Coupled with the fact that a good number of them grew up in isolation, a good number of them grew up with limited language access, a good number of them grew up with no family or early intervention access. Now, this is like a kind of foundation to the topic that we are going to be dealing with in the next 2-3 episodes. The other set of deaf persons, children and adults, are those who are born in a deaf family. They have deaf parents and in some cases deaf grandparents, and they inherited deafness, and they inherited the attitude, the cultural and linguistic attitude of deafness, of being deaf. What attitude did they inherit, and how do they carry this attitude? And these two settings are going to help us into understanding the difference between these two deaf persons in relation to sign language. So, our topic today says sign language attitude, deaf and hearing impaired. And in the next 2-3 weeks, we are going to be dwelling on this topic, looking at, we are going to look more on the hearing impaired, what goes on. Today we have talked about what causes deafness and what causes hearing impairment, and as opposed to deafness. And we are not suggesting that those who became linguistically and culturally deaf, the cause of their deafness is not similar to the cause of those who identify as hearing impaired. No, that's not what we are saying. Irrespective of whatever caused deafness or hearing impairment, what we are looking at is the attitude. But why did I bring up what causes hearing impairment or hearing loss in the communities that we have studied? To give you an idea of the attitude of the parents coming from the way their children lost hearing, or coming from the information they have or do not have about hearing loss and deafness. Some of these parents live in regret. Some think it is their fault that their children became deaf. And in that case, what do they do? And whatever they do or do not do has a whole lot of impact on their deaf children, and has a whole lot of impact on how the deaf child who became a deaf adult will look at sign language. This has a lot to do with our discussion on indigenous sign languages in African setting. Because if we have to get it right, if we have to get it right about the development of indigenous African sign languages, deaf attitude towards sign language use is a huge factor. We cannot overlook it. So today our topic is sign language use or sign language attitude, deaf and hearing impaired. And irrespective of what is going on around the world, we promise to keep doing this, and we ask you to keep watching us and sharing this video and liking it to help spread the information that is now readily available both in literature and in the classroom about what goes on in indigenous deaf communities and indigenous sign languages. I would like to say thank you for keeping up with us, and I will see you next week. Stay safe from coronavirus. Bye.